For the past year, a network of Care Massachusetts has been trying to help fill a gap in access to services for behavioral health needs by putting information online. The web tool is being taken to another level with more help for underserved communities, thanks to a culturally responsive behavioral health resource hub operated and developed by the Massachusetts Association for Mental Health. To tell us about the effort is the association's president and CEO, Danna Mauch. Thank you very much for being with us, Danna.
Thank you, Chris, for having me.
So it seems almost revisionist to say this, but network of care looks like something that somebody thought up for the pandemic, but this goes back a little before. So what were you responding to at the outset here?
So this goes back several years before the pandemic, when a group of leaders from around the Commonwealth were joined together to discuss what was called at the time Behavioral Health, the Unfinished Agenda for Reform. And we were looking at what were the sore spots in the delivery of behavioral health services to meet the diverse and complex needs of the people who live here in the Commonwealth, whether that was a need for mental health services or substance use services, which together are called behavioral health services. And we actually settled on a number of issues that needed to be addressed. But one of the most challenging issues for people is that despite the fact that Massachusetts is rich in resources, and by that I don't mean that there aren't any gaps in care, but we have a lot of providers and a lot of different services. But people who were trying to find help had a very hard time figuring out how that was organized and how to access care. And so one of the priorities that people settled on as a result of the deliberations of that working group was that we needed to help people navigate access. We needed to help people make sense of the system and take the first steps towards accessing care with good information. We also recognize that, we're not brought up in this culture to learn about our mental health and how to protect our well-being. We may have a health class in school, but there's rarely a mental health class. So people don't have education that would give them the kind of literacy about their health and well-being that would be optimal, particularly with stigmatized subjects like mental health and substance use. So we also put together a directory first of services, and there are more than 5,200 vetted services listed on the site, behavioral health services and related support services that people may need. And then there's a library of curated articles and reports about all health and well-being. There are over 30,000 items in that library. So you can take yourself to the site and familiarize yourself with the issues and treatments and whatever, but you can also familiarize yourself with services and how they're organized. You can search by zip code. You can search by the name of a service type. You can search by a diagnosis and other phrases like, I feel depressed. And a number of services will come up, and they will come up on a statewide basis, and there's a map that shows their location. Or if you put in a zip code and ask that you find services within 20 miles of that zip code, you'll get a geographic display and listing of those services.
Well, even among the people who are most adequately served already, there are misconceptions, misunderstandings about mental health. There are people who think that this is only a problem if you're sort of clinically extreme in some way. But how do you overcome that barrier for people who are even farther from the center, as it were, who have these different slants on the meaning of mental health and mental illness? How does this site, these new features in the site, help those populations?
Well, one way is education, because a lot of people's confusion about these things or misunderstanding is a lack of education. The other is by trying to simplify the way you find that information on the site. So we've recognized, for example, that during COVID-19, a lot of people who'd never addressed these issues before were grappling with them, but more importantly, they were grappling with the broader impacts of COVID-19, economic impacts and threats to work, social isolation, losing people during the pandemic without being able to grieve properly, disruption of kids in school, as well as their parents' work, et cetera. So we created something called the COVID-19 Hub, which is an immediate link on the homepage to information that can be useful to you during the pandemic. We similarly recently launched, because the other major issue that's arisen during this last year has to do with a reckoning with racial justice in our country. We recognize that people from communities of color, people from Black and Latinx and Asian communities have trouble accessing care that's culturally responsive, is the phrase we use, that's really responsive to their unique cultural, racial, or ethnic needs. And this is also on the homepage, and you can access information for each of those communities, as well as a broader group of services targeted to communities and people of color in general. And we also try to emphasize not only treatment for mental health and substance use conditions, but the importance of emotional supports and protecting and supporting your mental wellness, or well-being, as some people say.
Well, we're also talking here in Boston now, well, a large number of people, let's say, who are living with the disruption and anxiety of immigration. They're confronted with the stress of racism.
Mhm.
How does this portal help them with that?
Well, it does give them access to community organizations that are tailored to serve those different populations. There are, for example, in the services directory, there are not only mental health services, but there are services for people who have been experiencing poverty, whether that's revealed in food insecurity or housing insecurity during the pandemic. People, including immigrants who might need legal services, including free legal services. So there are those kinds of services available on the website. And then, of course, there is in the culturally responsive services hub, also organizations that are social services organizations, community leadership organizations, church-based organizations that are designed and really committed to primarily meeting the needs of people from the Black community or the Latinx community, Asian American community, or, as I said, the broader focus on communities and people of color.
One of the things I found from rummaging through the site, I think it was a provider from Ghana who was explaining that, and I didn't know this before, that if you think you might have a problem, you can call up and get a free consultation. And he even had some advice about how to get the most out of that limited amount of time. How important is information like that?
I think it's very important, because imagine that you've never dealt with one of these situations before. You haven't really had a history of anxiety or being depressed, or confronting this kind of traumatic stress. And it's not language we're easily comfortable with and familiar with, and you haven't even gone searching around on the internet. And then you're contemplating, reaching out for help, which is so hard to do. Tips like the ones you're referring to can help people with a bit of a script. How do I approach this? How do I talk to somebody? How do I ask somebody for help? It's really not language we're schooled in. And so I think it can also help people to kind of get over their initial worry about taking this first step into getting care.
Speaking of first steps, one of the most obvious things about this particular hub is if you look at the top, you see there are these language options. So we should make
Mhm.
sure we highlight that.
Yes. So we have embedded in the site a Google function that translates everything on the site into many languages, hundreds of languages. And then some of the resources that we have listed are targeted and translated to particular languages that are the most common languages in Massachusetts. So that is a very important feature of the site, because, and if we're going to talk about being culturally responsive, we need to be able to serve people from different linguistic communities than those who are English speakers.
We should finally mention, Donna, that if people want to find this on the internet, what should they look for exactly?
They should look for Network of Care Massachusetts. If you just Google Network of Care Massachusetts, the site will come up.
Well,
Or
thank you
any,
very much.
by the way, on any other search engine.
Right, right. Thanks for making that so obvious for us.
Yeah.
And thank you for taking the time to be with us.
Thank you so much, Chris, for having me and for caring about this very important issue.
That was Danna Mauch from Network of Care, Massachusetts. We'll have more news in just a moment.